Hi guys, this is going to be part 2 of our first class. This is actually, we're going to be reviewing chapter 79, which is ethical and legal issues of a caring-based practice, and chapter 82, which is putting caring into practice, caring for the self. I'm going to go into chapter 82 first because it's important, but it's a little less meaty than chapter 79. Chapter 79, there's some things I really want to get into with you guys that aren't even in the actual PowerPoints, but just information that I think is important to review with you as we continue on this APRN journey. All right, so the first thing we're going to get into is putting caring into practice by caring for the self. And again, we thought it was really important to incorporate this chapter into our module, especially here in the beginning, because I can't stress enough how important it is to practice self-care as a healthcare practitioner. All right, so let's talk about that. All right, so background, caring and self-care, conceptualization of the caring process. Caring is central to the nursing profession. Obviously, we base most of our actual care around caring. I mean, that is what nursing is. There is a new emphasis on self-care due to the need to retain nurses. And as we all have seen in practice, especially over the last 2 years with COVID, nurses is come and go like crazy. And one job to the next you can go to because somebody else is offering more bonuses and more sign-ons and more hourly wages and, you know, COVID testing, and you make tons of money. But then we lose our sight of our own self-care, and it becomes a problem. So there are 7 components of self-care that Godfrey established, and there are multiple definitions of what self-care is. So let's just go through that. So definitions of self-care, the World Health Organization established it as a deliberate action, which is ellipsis to maintain good health. Wilkinson and Whitehead quoted to say, not involving a health professional ellipsis, and the individual independently attains and preserves his or her desired level of health. The American Holistic Nurses Association defines health or self-care as an integration of self-care and personal development into one's life. Example, self-assessment, yoga, good nutrition, energy therapies, movement, journaling, and creative expression. We want to strive to achieve harmony in one's own life to assist others to do the same. And what does that even mean? So striving to achieve harmony in one's own life to assist others to do the same. So the bottom line is, if you are not taking care of yourself, yet you are educating and lecturing, not lecturing, so to speak, but you are giving advice and really trying to get a patient to change their behaviors, but meanwhile they see just from your own physical appearance that you are obviously not practicing what you preach, that is questionable as a patient. And I myself do not like to choose healthcare practitioners that are not their best selves, because I don't really have a lot of faith in my own healthcare practitioner giving me advice as to how I can be my best self if they are not striving to achieve their own best self. You know what I mean? So that's why it's so important that we really get into the definition of self-care, and you need to consider what you consider your best self-care for yourself. What do you do for your own self-care? How often are you exercising? Is your weight where it should be? Are you eating healthy? Are you doing stress relieving activities? Are you making sure you're eating good nutritious food and fruits and vegetables, taking your vitamins? You know, these are all very basic things that we all are very well aware of what we need to do. But the question is, are you actually doing it? And this is something you really, really need to reflect on for your own standard of care, not only for your standard of care for your patients, but standard of care for yourself. So Orem points out that those activities performed independently to promote and maintain one's well-being throughout life would be a definition of self-care. So challenges to self-care for the APRN. I'm going to give you the first challenge, which is not listed here, and that is simply the challenge to actually put into practice what you need to do for your own self-care. To say that changes in the healthcare system are a challenge for you to take care of your own self is, to me, not an excuse. Obviously, we're always going to be in challenging workplaces with challenging situations. Healthcare in general is very challenging at times, but that doesn't mean that you don't need to take care of yourself and put yourself as a priority. So just keep that in mind. So more challenging places. And then, of course, having to maintain the QSEN competencies. So most of these healthcare systems we find now are putting into place these 6 core competencies, the QSEN competencies, which include patient-centered care, teamwork and collaboration, evidence-based practice, quality improvement, safety, and informatics, okay? But okay, so these are changes in the healthcare system that are giving us more challenges to promote our own self-care. Another challenge are changes in insurance and technologies, compliance with insurance regulations, and of course, integration of the electronic health record. So, I mean, are these really specific challenges that would influence your own ability to self-care for yourself? I don't know. I mean, there are definitely challenges that will occur on the workplace, but in terms of actually the ability to provide your own self-care, I think you need to look at what the challenges are in your own life, not just in the overall healthcare system. Some other challenges that you probably have, dealt with yourself are societal changes, joblessness, poverty, undocumented persons, cost of medical treatment, aging population, confusion over professional boundaries. These can all obviously have an impact on your ability to self-care. One of the things I find a lot from a lot of the nurses I work with is that a lot of the times the nurse profession, we tend to be the breadwinners in the household, especially as APRNs. And so, that can be definitely a challenge for us to maintain self-care as well, because we're so busy trying to keep those bills getting paid that you're not taking time out to help yourself. Some professional changes could also be a challenge, like challenges from the development of interdisciplinary education and healthcare teams. So, obviously, if you're in school and you're spending an excessive amount of time studying and you're really stressed out, that can obviously cause a challenge in your self-care. But again, all of these challenges do not make it any less important for you to maintain your standard of care for yourself. Okay, so really consider, what are your standards of care for yourself? Or do you need to change your standards? And what can you do to apply that to your life? And treat yourself as if you were your own patient. What would you say to yourself if you were your own practitioner? What would you tell yourself to do in terms of taking care of yourself? And then you need to put a plan in action to make it happen. So obviously, compassion fatigue and burnout are big factors right now in the healthcare industry. My entire company was established around the concept of compassion fatigue, because we were finding that providers could not maintain just the basic standards of care because they were becoming so, overworked and just are not maintaining their standards of care. Not to say that that's right or appropriate, but our company was established to provide APRNs into different facilities to give them a little respite and guidance. So compassion fatigue occurs when a provider cannot rescue or save an individual from harm. It leads to feelings of guilt and distress, which appear suddenly. And then, of course, you have burnout, which is, the caregiver frustration over time, a sense of loss of control, increased willful efforts, and diminishing control. So you're doing, and you're not seeing a whole lot of change. And then people tend to get burned out. I mean, burnout could also just be from the simple fact that three of your fellow colleagues called out, and now suddenly you're working 2 doubles. That's obviously another reason. So principles of self-care management. What does it actually mean to self-care? What does it mean to manage your own self-care? So it's a matter of balancing caring for yourself with caring for others. So if you spend 8 hours of your day caring for others and you don't even bother to spend an hour caring for yourself during the day, this is a problem. And by an hour of caring for yourself, I mean an hour of a walk, an hour of cardiovascular exercise, an hour of just spending some time getting your nails done or your hair done, or any of those things that keep your sense of self cared for. It is a lifelong commitment to personal development to manage your own self care. Keep in mind that once you start to manage your own self care, you become more self aware and knowledgeable about how your body works. It becomes much easier to explain and educate your patients on how they too can self care and learn about their own bodies and their body's needs. So obviously, like I just said, as you develop your self-care management over time, you start to expand, your understanding of what self-care is, both for yourself and your patient. And again, please reflect on your own ideas of what self-care management entails, especially in your own world. For me, self-care includes exercising 4 to 5 times a week. It includes facial masks, like I like to do my skincare mask every couple of days. It includes doing my nails and my manicure and pedicure weekly. It includes making sure my hair is done every few weeks. Like those are things that for me are self-care managed. They maintain my a very beautiful professional appearance, which also helps give my patients some confidence in my authentic persona. Okay, as we talked about in the last chapter. So self-compassion, that's another thing that is incorporated into self-care and your management of yourself. Are we perfectionists to an extreme? I am. I have a tendency to be a perfectionist in many avenues of my life, and it does lead to some issues because then you can't get out of your own way sometimes. Often you can accept efficiency in others, but hold yourself to unreasonable standards. I actually find I do the opposite. I hold myself very high, like to hold high standards. And then it turns out that I end up having the same standards for my colleagues who can't measure up. They never can seem to measure up. So I have to check myself with that sometimes. I can't always expect people to do what I would do in situations. Self-compassion also demands a sense of emotional intelligence where you're becoming more self-aware, motivated, empathetic, and you become more socially apt as you develop this self-compassion. Because when you develop self-compassion, it reflects in your ability to deal with other people and provide them with the compassion that they may need in their time of need. Sorry, guys. All right. Okay. So emotional intelligence, Fitzpatrick found a positive correlation between self-compassion and emotional intelligence. So in that respect, we want to look at your current level of emotional intelligence, right? Like, how do you handle things? What is your system, so that you don't get overwhelmed or lose your cool? How do you handle your situations? So again, if you're caring for yourself and you're exhibiting self-compassion, this will help you develop more of an emotional intelligence, which can definitely affect your practice, obviously, especially when you're dealing with high intense situations with some of your patients. So critical components of self-care include resilience, positive intentionality, and holding thoughts of caring, loving kindness, and open receptivity. So in terms of resilience, we want to just try to be positive when we have to adjust to different stressful situations. We want to try to associate and look at the good side of things. We want to associate outcomes with hope, positivity, and self-efficacy. We always want to try to look at the brighter picture or the better the better results that could come from, or what we're hopeful for. We want to consider positive intentionality, where we have a focused consciousness and energy, according to Jean Watson, on positive things happening. So we're not putting out negative energy into the world where we're consistently saying, oh, this is terrible and this is going to probably be what's going to happen. We don't put that kind of energy out there. We really try to help our patients focus on day-to-day positive things and just keep taking things day by day. We want to encourage ourselves as well as our patient to hold thoughts of caring, loving kindness, and open receptivity, which obviously can enhance caring energy, which leads to healing and improved health. So the process of self-care management, in the process of self-care management, we're able to assess our patient's readiness to change. But are we able to do it in ourselves? Again, we're so busy here trying to teach you how to help our patients change and make positive changes for their health. But what about doing it for your own health? How many of you guys smoke cigarettes, or how many of you guys are overweight or obese? These are issues that involve the need to make a new plan for self-care. You have to handle your own issues before you start trying to treat other patients as well. Just keep that in mind. We want to reflect on strengths and areas where one needs support and growth and change. So is it a way of being in the world and with oneself, and engagement in the process of caring for the self? So goal setting. So how are we going to go about and do these self-care management techniques and make these changes? We have to set goals. So here is where you're going to list, some specific strategies that are meaningful for you. And in doing this, you're learning how to teach your patient how to do this, because many of the behaviors that you need your patients to change as you're dealing with their specific needs, especially in the primary care setting, you need to have them develop goals. You can't just say to them, all right, this is what you need to do, X, Y, and Z, and things will get better. No, no, we have to set goals and a process into how they're going to get to these points. So the first thing we need to do is identify strategies, specific strategies that are meaningful for you. Historical roots of goal setting include Florence Nightingale. And one of her goals was how to put the body in the best position for nature to act on. So in this case, your body, mind, and spirit. Okay. And then you want to consider the interconnectedness of all parts of the human, with the whole being greater than the sum of the parts. And we know this theory from Martha Rogers. So implementing strategies. So they can be divided into categories for all components of well-being of the individual. So you can break it down into physical, psychosocial, and spiritual components. You want to have realistic expectations for the performance in each clinical area. And you want to make sure that you realize that life stressors can compound professional stressors. So obviously, if you have stressors coming from both ends of the spectrum, it's going to get over the top. So you really have to look at all these components and try to minimize things where you can to prevent things from becoming overwhelming. Another thing in terms of implementing strategies is looking at physical signs and symptoms of increased stressors. So anything that's causing increased stressors, whether it be people, situations, events, we need to try to see if we can manage those by either removing them or intervening to lessen them. You want to allow yourself or your patient extra personal time for reflection and meditation. You need time to sit and think about what you're doing, what you want to do differently, how you're going to change it, and what your expectations are. This is the time, when you're doing that extra personal time for reflection and meditation, this is where you want to encourage patients or yourself to journal. Journaling can be quite therapeutic, or even consider talking to a counselor about their reflections and what they might need help in doing in terms of implementing strategies for their goals. And this is where you would try to see what their insurance covers, what they have access to in terms of referrals for treatment programs or any kind of mental health needs. Again, what works for you individually? You want to discuss that, and you want to discuss that with your patients as well. What works for them? What has worked for them in the past? And what do you anticipate will work for them in the future in terms of what they have access to, resources, financial, and just, location wise. In terms of your own strategies for yourself, you want to develop your own inner circle, a trusted peer group with similar beliefs. You want to be careful with that, especially if you're hanging out with a lot of practitioners. Just be careful that it doesn't turn into like a kind of a complaining time, as opposed to something that's actually therapeutic, where you guys go do an activity where you don't have to be sitting around talking about just work stuff. Discussion of stressors and debriefing. That's always helpful, obviously, especially when you're working with your colleagues, and is especially helpful during transitions, of course. And then humor and laughter always can bring positivity and hope, and is really helpful in just bringing more positive energy into your life. So more strategies for self-care include mindfulness-based stress reduction, which reduces stress and anxiety. Energy fields like therapeutic touch, directed intentionally, can definitely provide positive benefits. And then, of course, Reiki, which is energy healing. It's a complementary type medicine. And Reiki's focus is really to balance the energy flow to a positive state. That's putting it very broadly. Reiki, I'm actually a Reiki practitioner. And what the goal of Reiki is to balance your chakras. So there are 7 energy centers within the being, the physical being. And what we try to do is open those energy centers to allow the flow to become more natural and less obstructed from disease state. So Reiki can actually be extremely therapeutic when it comes to stress and just overall well-being. So in terms of what works for you, you want to share your experiences among one another to hopefully help facilitate others people self-care avenue. You want to create a plan of care for yourself, and then how will you evaluate? What are you going to be doing to evaluate if you're actually making progress? And then again, what are your goals, your hopes, and your dreams as an uh, advanced practice nurse? For me, I definitely had my goal, and I still do have my goal to be in holistic health, um, in that it's more of a primary prevention. You know, I want to work with people who are not quite sick and want to really get their bodies into the best physical shape they can be in. That's my goal. I also want to focus my practice on holistic type cares, specifically with Reiki healing. But that's long term. I still had goals of working for the first 5 to 7 years as in my practice, you know, in different realms, just to make sure I'm getting a good baseline of experience that I can offer my patients a very well-rounded experience. Okay, in terms of actualizing our potential, we're unleashing the power of advanced practice nursing. I mean, this is a big deal. Again, this is an honor to be able to be in this role. This role is actually not that old. I mean, it just really pretty much started in the 70s. So, you know, keep in mind, we're pretty new and upcoming as a profession compared to other professions anyway. In terms of ethical considerations, we are there to facilitate healing and to alleviate suffering within a context of the mind, body, spirit awareness. And healing from within. So we must remember our roots. We must remember what makes us unique, valuable, and necessary in this role. Okay. And this is more true than ever now that we're in a world of rapid change, broken systems, and constant evolution, especially with our technology. And people really, the hope is in our profession that people will learn from APRNs about caring for the self and the importance of it. You know, my dream has always been that, you know, when people see APRNs or nurse practitioners, they are inspired to take care of themselves. And I always hope that patients get that from me when they see me. I get a lot of compliments on my physical health because I make it a point to make sure I exercise, and I share that with my patients, and they really appreciate it. Many of them have told me, you know, how much it inspires them to maintain their own health. So that's really the kind of energy you want to emit towards your patients as you're going forward. Okay. All right. And last but not least, leadership role in transforming healthcare. So when you're taking on this leadership role as healthcare does transform, we're moving from the sick care system to a true wellness model. And that's what I was mentioning to you guys before. You know, it's not just about taking care of people when they come in and they're already blatantly sick. It's about preventing people from becoming sick at all by focusing their care on a wellness model. We want to, you know, definitely promote healthier futures for all. And we want APRNs to direct their skills towards creating a peaceful, harmonious environment for their patients. And again, the idea of caring for yourself is specifically also to give examples from your practice, how much the importance of self-care is important. And this is something you want to make sure you're promoting in your patients' livelihood. All right, so that's it for self-care. Next, we're going to move on to chapter 79, which is the ethical and legal issues of caring-based practice. So here we go. Let me just switch over to that PowerPoint. Here we go, chapter 79. Okay. So ethical and legal issues of caring-based practice. So the first thing we're going to get into is just what defining ethical issues, like what does it mean? So ethics is what one ought to do. Bioethics is when the moral choice involves healthcare. And dilemma includes a situation where there are several unequally satisfying solutions or when there is a conflict between one's values. So the American Nursing Association Code of Ethics has 9 provisions. So here's where they go. First one is the nurse practices with compassion and respect for the inherent dignity, worth, and personal attributes of every person without prejudice. Okay, so that's number one. So we're practicing with dignity. We know that. The nurse's primary commitment is to the patient, whether an individual, family, group, community, or population. Of course, right. We are our patient's advocates, right? Next, the nurse promotes and advocates for and protects the rights, health, and safety of the patient. Absolutely, that is part of our role, right? A lot of this is very basic, guys, but it's so important that you are solid in what the expectation is in terms of the code of ethics, because again, you can be brought up in court, under malpractice if you're somehow out of one of these code of ethics. So it's really important you are knowledgeable that they exist, okay? The nurse has authority, accountability, and responsibility for nursing practice, makes decisions, and takes actions consistent with the obligation to provide optimal care. Again, we're upholding our role by maintaining our responsibility, our education, and making the right decisions. The nurse, the nurse owes the same duties to the self as to others, including the responsibility to promote health, safety, preserve wholeness of character and integrity, maintain competence, and continue personal and professional growth. Okay. So remember, in this code of ethics right here, this is saying that you're owing the same duty to the self as to others, including the responsibility to promote health. Okay, so again, that comes back to self-care. You're just as responsible to your patients as you are to yourself to maintain your self-care. Keep that in mind as part of our ethics as a nurse practitioner. The nurse, through individual and collective action, establishes, maintains, and improves the moral environment of the work setting and the conditions of employment conducive to quality health. So as a nurse practitioner or a nurse, you are maintaining standards within your practice that you're being held responsible for upholding. So if the standards are not what they should be in the environment you're working in, it is your duty as the NP to make changes to make that happen. Okay, especially if it's your practice. Okay, the nurse, whether in research, practice, education, or administration, contributes to the advancement of the profession through research and scholarly inquiry, professional standard development, and generation of nursing and health policies. Okay, so that's like, obviously, you think to yourself, okay, well, obviously, as I'm going to keep up with the latest research, I'm going to keep reading, I'm going to look at articles. Yeah, well, that's great that you want to just say you're going to do it. The reality is you have no choice in the matter. When you go to renew your license every year, every 2 years, depending on what your state guidelines are, they require you to enter in that you have put in a certain amount of practice hours. Usually it's a certain amount of CEUs that every state requires differently for you to maintain while you're licensed. So in order for you to renew your license, you have to prove that you did these certain amount of educational credits or certified educational something. What is it? Yeah. So that you need to put that in when you go to renew your license. So keep in mind, there are lots of resources out there. Once you get your license, you're going to get lots of advertisements in the mail for little CEUs you can acquire as time goes on to help just renew any kind of updated practice, treatments, records, research, anything like that. So that is a standard that is required as an APRN, that you continue to maintain your education. And there's a certain amount of hours that are required with every licensure renewal. Another code of ethics, the nurse collaborates with other healthcare professionals and the public to protect and promote human rights, health diplomacy, and health initiatives. So that's simply saying you need to make sure you're keeping up to date with what's going on in the healthcare world in terms of any updated insurance changes or law changes or guideline changes. The profession of nursing collectively through its professional organizations must articulate nursing values, maintain the integrity of the profession, and integrate principles of social justice into nursing and health policy. Okay, good. So our profession of nursing has our back in that it also has its code of ethics it needs to maintain. Okay, so theoretical approaches. So we have deontology, which it was started by Immanuel Kant, and it's underlined by the principle of universal salability. And it's act the same in similar situations in that the mean justifies the end. Okay, next we have teleology, which is virtue ethics, which this is the study of goals or ends. It was started by basically Aristotle. He developed virtue ethics, and then John Stuart Mill developed utilitarianism. But they're basically just different forms of teleological ethical positions. And the main principles of the teleological approach are: number one, that the greatest amount of happiness and the least amount of harm, and that the end justifies the means. So the idea of teleology is that there are specific goals that a human life is to achieve. Like that's their thought process. So for example, teleology would promote that a human being ought to achieve happiness. And so therefore that's the goal. And that's the way that kind of theoretical approach is to their ethics. Next, we have the next ethical principle of autonomy. Okay, and what do we have in autonomy? We have self-determination, respect for all persons. It's restricted by paternalism. Also, we're looking at competence, capacity, and substituted judgment. And an example of autonomy would be informed consent. So remember, autonomy is the obligation to ensure that mentally competent adults, patients, have the right to make their own health decisions and express treatment preferences. Keep in mind, if your patient is mentally incapacitated, then obviously the designated surrogate is, their choices are then respected. Whether it's now in terms of mentally incapacitated, we're talking about like dementia or coma, that kind of thing. Remember, a mentally competent patient has the right to decline or refuse treatment, even if their adult children disagree. So keep that in mind. And let me give you an example of autonomy that I think would be helpful. So for instance, let's say we have an adult elderly female patient who has breast cancer, and she decides that she's going to have a lumpectomy after discussing the treatment options with her oncologist. The woman's daughter tells the NP or tells you that she does not want her mother to have the surgery because she thinks her mother is too old. Now, as an NP, you have a duty to respect the patient's decision. And so in this case, you would say to the daughter, well, I understand what you're saying, but you need to discuss that with your mother, because at this point, we're going to go with what your mother, the patient, has decided, which is that she's going to go ahead with the surgery. And in this case, remember, you're acting as the patient's advocate. Next, we have beneficence. So in beneficence, this requires positive action, okay? What we're trying to accomplish in beneficence is the NP's role is as the obligation to actually help the patient, all right? We're removing harm, we're preventing harm, and we're promoting good. Beneficence is also known as do no harm, okay? We're acting in the patient's best interest. We're providing compassionate care, and it is the core principle in patient advocacy is beneficence, okay? So an example would be like educating a patient with a new prescription about how to take the medication. Or another example would be encouraging a patient to stop smoking and enroll in a smoking cessation program. Okay. Another example would be calling a surgeon to get a prescription for stronger pain meds or a narcotic following a post-surgical procedure when they have severe pain. Okay. Those are all examples of beneficence. Next, we have non-maleficence, which is also do no harm. But the non-maleficence is more of an obligation to avoid harm and protecting patient from harm. Okay. So for example, non-maleficence would be the difference between non-maleficence and beneficence is that in non-maleficence, you're not required to take positive action. The idea here is not that we're taking positive action, but we're not harming the patient. We're not doing anything to cause harm. We're not doing anything positive, but we're not actually doing anything to cause harm. Okay, so an example here would be coercing a patient to participate in unwanted chemotherapy. All right, or an example would be a middle-aged woman with osteoporosis wants to be treated with bisphosphate. The nurse practitioner advises the patient that she's not a good candidate for these drugs because of her past medical history of GI bleeding and peptic ulcer disease. So the NP decides not to prescribe these. So in this particular instance, we're practicing non-maleficence by not prescribing something that we know would probably cause her harm. Next ethical principle to be aware of is veracity, and that's truth-telling. Okay, in veracity, we have an obligation to present information honestly and truthfully in order for patients to make informed and rational decisions about their healthcare information. And it could be all healthcare information, including bad news, which should not be withheld or omitted. So an example of veracity would be like here, honestly explaining an advance directive, because obviously we're probably talking about the advance directives because we know that death is on the horizon, kind of thing. Another example would be like, for instance, we have a mammogram result of a 64-year-old patient that is showing that is highly indicative of breast cancer. The patient's son is explaining to the NP that he does not want his mother to know about the results because he doesn't want to upset her. Oh my God. Hi guys, sorry. So back to veracity. So again, back to the example of veracity. So the results of this mammogram for the 64-year-old patient showed breast cancer. The son didn't want his mom to know about the results because obviously he didn't want to upset her. But unfortunately, as an NP, we have the duty to discuss the mammogram results with the patient and refer her to the breast surgeon. So it's important for you guys to become familiar with these different ethical principles because, the ethical concepts of beneficence, veracity, non-maleficence, justice, and how they are applied, because they do ask these things on the boards. There are definitely random questions about how to apply these particular principles. They're not specifically asking about the principle, but they're giving you situations where the principle is in action and how you would respond as an NP. So just make sure you're familiar with these different concepts. Next, we have confidentiality. This is obviously the obligation to protect the patient's identity, personal information, test results, medical records, confirmations, and other healthcare information. This right is also protected by the Health Insurance Probability and Accountability Act, also known as HIPAA, okay, which restricts release of patient information. Psychiatric and mental health medical records are protected information and require a separate consent, so keep that in mind. Keep in mind, in terms of the HIPAA privacy rule, let's give you an example. It protects most individual identifiable health information in any format, whether it's oral, paper, or electronic. It could also be known as protected health information, PHI. The PHI includes demographic information as well as the individual's past, present, or future mental health and provisions of care. So, confidentiality is a big deal in this world. We know all about HIPAA guidelines, so just make sure you're very, very aware of it and put that into your practice. Fidelity is our next ethical concept that I wanted to review, and that's basically just the obligation to maintain trust in relationships. You're going to keep your promises, avoid false expectations, and you just want to make sure you're keeping one's promise. So the relationship between a patient and their healthcare team is important. The primary care NP should try their best to develop a trusting relationship with a patient. Telling the patient you will request a consultation and then following up on it is a perfect example of fidelity, of just doing what you're going to say, doing what you say you're going to do, and making sure it happens. Okay, justice. So justice is fairness and individual rights. This is the quality of being fair and acting with a lack of bias. The fair and equitable distribution of societal resources is like an example of justice. So it's complex, and sometimes justice is difficult to maintain as an NP. I'm not going to lie. It can be very complex and difficult to apply in healthcare. For example, who should get the heart health transplant or who should get the remaining ventilator? These are big, complex questions, but you just have to do what's fair and what's right and try to do without bias. Okay, guys. So here is a mnemonic to help you establish resolution guidelines. So we're going to look at the mnemonic ethical, and E stands for examine all the data. T stands for think of all who should be involved. H, you should humanize the situation by making a decision tree. I, incorporate principles, statutes, and standards. C, choose an action. A, act. And L, look back and evaluate. This is a great mnemonic to figure out if you're coming up with good guidelines to find a resolution to whatever situation you're dealing with. Consider things, you want to consider the relationship between ethics and law. What is legal is not always ethical, and what is ethical is not always legal. Sometimes situations are both legal and ethical, and sometimes situations are both illegal and unethical. And sometimes situations are illegal and ethical. Is that a thing? It is. Unfortunately, there's always a gray area in life. Scope of practice. We want to know the duties and responsibilities of your license, know your state practice act, and know which governing body is responsible for your APRNs in your state. Okay, so we need to talk about this. This is important. Okay. Remember, you want to remember that NPs receive their right to practice from the state legislator, okay? Just some things I wanted to review with you guys. Let's see here. Okay, that was pretty much it for that. All right. So in terms of knowing the duties and responsibilities of your license, something we're going to get into is accreditation. Okay, this is important for you guys. There's a whole lot that comes with, okay, yeah, you went to school, you met all your clinical hours that you needed, you graduated, you got, you passed all your classes. So now you have your all the licensure work you needed to sit and take your boards, right? So here's how it goes. So first things first, we have to make sure we get an accreditation. An accreditation is a voluntary process through non-governmental association that evaluates and certifies the organization that has met the requirements and excels in its class. For example, the American Nursing Credentialing Center and the National League for Nursing Accrediting Commission are accreditation organizations. So these accreditation programs actually accreditate our school to make it able that you can do your schooling and get your education and clinical hours through Goodwin. Okay, so just so you know that. That was the one thing I wanted to make sure we reviewed. Okay. What else did I want to make sure? Oh, here it is. Okay. So remember, an NP must meet the minimal education requirements that are mandated by the Nurse Practice Act of the state. So right now, Goodwin is making sure, your university Goodwin is making sure that you're meeting those minimal educational requirements. This Nurse Practice Act is enacted into law by the state legislature. Therefore, the NP's legal right to practice is actually derived from the state legislator. Now, remember, each state has its own Nurse Practice Act that contains regulations that dictate your educational rights, requirements, responsibilities, and scope of practice. So then what we have next is the State Board of Nursing, which is responsible for enforcing the State Nursing Act, okay? They're the ones that give you the legal authority to license and they're the ones that have the authority to actually revoke your license if necessary, okay? So keep in mind, as an NP, we're looking at licensure and certification, two separate things, all right? It's not cheap to be a nurse practitioner, just keep that in mind, because every little step of the way, you're paying some big buck, okay? Let me just break that down for you. Licensure is a legal requirement to practice as an NP, which is obtained through the governmental entity, and that is made, the NP meets that licensure by meeting the minimal educational and clinical requirements. So you're eligible to be licensed once you're finished with school, you pass all your courses, and you get all your clinical hours, okay? That's when you're able to sit and become licensed. The certification is generally a voluntary process. And this is what they tell you, that it's a voluntary process. And it's done through a non-governmental agency, such as a professional nursing association, aka the ANA or ANCC. Okay. The majority of the states in the United States now mandate certification as a condition to obtain licensure. Okay. So what does that mean? That means in order to sit and go get your license, apply for your license, you have to have gone to school and did your clinical hours. So you guys are already on the road to obtaining your license. All right. So once you get your license, then you can sit and get your certification, aka you can go and take your boards to get certified. Now, technically, in every state, you don't need a certification to actually work. You could just work with your license. But unfortunately, the majority of places, no, actually not unfortunately, fortunately, the majority of places do require the certification because they want to know that you took your boards and passed them. They don't want to know that you just went to school and got your license. Okay. So once you get your license, then you're able to sit and get your certification and apply for that. Okay. 2 different fees, 2 different processes. We will guide you through them as the time comes, but I just want you to mentally prepare yourself that that is what you will be having to sit and do in order to get your certification. I have never been to any place of employment that did not require both licensure and certification. They want to know what certification board you took, and they want to know your certification number. Okay. So now that being said, now you're certified and you have both your license and your certification and you're ready to practice and start applying for jobs. Keep in mind that depending on where you work, you will need to develop a collaborative practice agreement, which is a written agreement between a physician and the NP outlining the NP's role and responsibility to the clinical practice. Because remember, every state requires a certain amount of hours that you work under the physician before you're allowed to work independently. This is not a bad thing. This is actually a very good thing in the scheme of things. Especially as a brand new APRN, you want to have somebody looking over your shoulder, making sure you're not making any mistakes that could potentially harm or actually really hurt your patients. Okay. So anyway, if not all states require this, but a lot of them still do, that you have a collaborative physician agreement. And basically it's just a contract that you and the physician you're working under sign, that just kind of makes that indicates that that doctor is going to be looking over your shoulder and checking in with you every so often, to make sure you have all your questions answered, and they can provide you with any guidance or feedback that's necessary to help with your practice. So keep in mind, some states allow full practice under the exclusive authority of the SBON, while some states allow only reduced practice and some have restricted practice. In terms of prescription privileges as NPs, keep in mind the majority of states require nurse practitioners to have a written practice protocol with a supervising physician in order to prescribe drugs. The protocol usually contains the list of drugs that the NP is allowed to prescribe. In the United States, all 50 states grant prescriptive authority to NPs, including the right to prescribe controlled substances once you obtain both your NPI number and your DEA number. Again, more things that you will be applying for. Okay, again, that's DEA and NPI number. All right, so just so you know, again, we're going to be reinforcing all of this with you as time passes on and you get closer to the end. We'll just reinforce with you what you need to start applying for. But I just want to really give you a kind of an umbrella of what to expect. So we're looking at licensure, certification, a DEA number, an NPI number. These are all things that you're going to be applying for once you go into practice that you're not going to be able to practice without. So very important for you to be aware of that. Okay. So in terms of the NPI number, some of you already actually may have one of these. It's called a National Provider Identification Number. It's a 10-digit number that's assigned to healthcare providers or to any entity that bills to Medicare or Medicaid. It's issued by the National Plan and Provider Enumeration System. And all providers who provide services and bill Medicare must have an NPI number. Okay. So you can apply for that online. It's actually, I'm pretty sure it was free, but you do have to apply for it in order to be able to bill. All right. So that's just a nice review of what the scope of practice and your licensure certification is going to include. Models for advanced practice, we're looking at the APRN and consensus work group, the National Council of State Boards of Nursing APRN committee, and established expectations for APRNs include the acronym LACE, which include licensure, which we just talked about. So you're already on your way to being eligible to be licensed based on the fact that you are in an accredited program through Goodwin that will provide you with the classes, credits, and clinical hours you need in order to be able to be licensed. Then you're going to, and in terms of accreditation, you're working with your Goodwin, which is accredited school. Then you're going to sit and work on your certification once you are ready to sit for your boards, and then you will become nationally certified. And then, of course, in terms of education, you will continue to further your education, and every 5 years you will, or I don't know how often it is depending on your state, but every time you need to renew your license, you will be required to provide those CEUs or that outside education that you participated in to maintain your accreditation. So, okay, let's get into prescriptive authority. So we're talking about that in terms of legal authorities. Legal issues. So we have prescriptive authority. There's different regulations, which is important for APRNs to know the extent of and restrictions to in terms of prescriptive authority. Medication errors are a big, big problem, as we all know. So that's why it's so important that you are, just make sure that you are work under people who can provide you with guidance if you have any questions or you need to make sure that, you're double checking when you write prescriptions. In terms of reimbursement, there is unequal pay, so just keep that in mind. It's really hard, but it is something that we deal with as NPs, that we do have unequal pay compared to physicians in some cases. So that is something to keep in mind. Usually the physicians will get about 100% of the fee, and NPs that provide the same care will get about 80% of the fee that's usually billed. So right now, also some legal issues that are going on that are is the legislative challenge and barrier to full practice authority. So again, in some states, you have the ability to work 100% independently, even before you have those certain amount of hours in, especially when you first start, while some states still require, like for instance, New York requires 3,600 hours, which is about 3 years of working under a physician before you're able to work independently. So just make sure you know the guidelines for your particular state. We will talk about, we'll get into this a little more specifically to Connecticut as time goes on. Not all of you live in Connecticut, or are going to practice in Connecticut, I should say. The likelihood is, some of you will be practicing in New York or even in Jersey. So you want to make sure you know your practice guidelines. So malpractice, something important to definitely consider. You want to understand the pros and cons of carrying malpractice insurance. Keep in mind, malpractice insurance as an RN versus an APRN are very, very different, much different in cost and very different in terms of how it works. 3 components to establish malpractice. You must have a duty to the patient, you must deviate from the standard of care, and you have harm or damages have resulted as a result of whatever you've done in terms of malpractice. Now, in terms of malpractice insurance, I wanted to go over this. There are 2 types of malpractice insurance for the APRN. There's claims-based and occurrence-based. And it's really important you know the difference, not only for your exams, for your life, for clinical practice, but they do ask questions about this on the boards. So I really want to make sure you understand it. So we have 2 types of malpractice insurance. One is claims-based, and this type of malpractice insurance only covers claims if the incident occurred when the NP paid the premium, and only if the NP is still enrolled with the same insurance company at the time the claim is filed in court. So basically, this type of malpractice insurance only works if you're still enrolled and still paying for it when the event happens, okay? The claim will not be covered in the future if they do not have the same insurance company as when the lawsuit was filed. So if you bought tail coverage, you could help address this issue, but if you don't, for some reason, then again, the claims-based insurance policy only works if you have it currently and the event happened while you have it and are still paying for it. So like if you fast forward work in another job 3 years from now, and you have that insurance at the time that the malpractice event occurred, it no longer will cover you anymore because you don't have that insurance anymore. So then you have the other type of insurance, which is the occurrence-based policy. So again, there's two types of policies: claims-based, which works when you have the claim and if you're currently in the claim and currently paying for the claim, and the event happens while you're in the claim, versus occurrence-based, which this type of malpractice policy is not affected by job changes or retirement. If a claim is filed against the NP in the future, it is covered if they had occurrence-based policy at the same time the incident occurred. So for example, an NP who has been retired for 2 years has a claim filed against her for an incident that occurred while she was employed and insured. Since she carried an occurrence-based policy, the claim will be covered. So basically, if you want to be extra careful, you should just start your career out with the occurrence-based policy and just keep it going from there. It is more expensive though. All right, so just keep that in mind. I did a quote recently, and you know, when I had my RN license, I think I was paying maybe $100-$150 a year for my malpractice insurance, and as an APRN now we're looking at about $1,500 per year. So there is definitely a difference. Keep in mind too, your malpractice insurance also may be covered by the company you work for. So that's something else to consider as well. That's definitely an incentive to work for a company, is that they cover certain costs, whether it be licensure costs, recertification costs, continuing education costs, and of course, malpractice costs. Those are things to consider when you take on your next role or job. So IOM, the report, the future of nursing. So what is IOM? IOM is the Institute of Medicine, and they develop reports to give us some guidelines and they talk about legal issues and the scope of practice. So in here, they're talking about the future of nursing. And what are the things that are included in this report? Number one, they say nurses should practice to the full extent of their education and training, which is of course what ideally we would like to do. Nurses should achieve higher levels of education and training through an improved education system that promotes seamless academic progression. Nurses should be full partners with physicians and other healthcare professionals in redesigning healthcare in the United States. So for me, that's number 3, is probably one of the most important points I wanted to point out to you guys. Like, we are there to try to make a difference. And not only in our patients' lives right now, but in the system in going forward in terms of the bigger picture. You know, if you see something that you think could really make a change in practice, then why not try to set up some new standards and put out some research and gather some data to help make that change. You are developing an education that will enable you to do such a thing. So keep that in mind. The tool belt you're about to walk out of school with in order to make big, giant changes in the healthcare system is tremendous. And you know, you will have these tools available to you once you graduate. So keep in mind, the role you're about to walk into could be utilized at so many levels. And of course, number 4, effective workforce planning and the policy making required improved data collection and a developed information infrastructure. So again, just trying to make better policies and planning within your practice. So 5 core educational competencies that the Institute of Medicine wanted to reinforce is to provide patient-centered care, work in interdisciplinary teams, use evidence-based practice, apply quality improvement, and use informatics. And informatics is just like the technology support apps, whatever technology support we can use to make healthcare better. Some questions for healthcare reform to consider. Does preventative care produce significant long-term cost savings? Absolutely. How could it not? Do you know how much obesity is costing this country? It's tremendous. It is tremendous. The CDC put out a recent study that 20% of every population of every state in the United States is obese. And I don't just mean overweight in every state, I mean obese. So imagine the amount of health drain that's causing on the healthcare system at this point. If we could prevent the obesity, consider the amount of long-term cost savings we could produce. Another question to consider in healthcare reform is, would an employer pay or play requirement increase coverage levels? Another question to consider, what's the relationship between tort reform and medical malpractice costs? And finally, what can be done about prescription drug prices, things that we know are so significant, such significant issues in our patients' lives. So here is just a resolution guideline construction tree, decision tree that I wanted to just kind of point out to you guys. Again, we show you algorithms all the time to give you a guideline in terms of diagnostics or differentials or treatment. Please use these decision trees. They're so helpful, like just to give you a guideline in terms of managing your care and deciding what you're going to do in your differentials. So for instance, here's the guideline for agreeing to a mammogram versus refusing a mammogram. So if we're agreeing to the mammogram in terms of negative, they'll give her peace of mind, because if the mammogram comes out negative, it'll give the patient some peace of mind. Great. If a lump is present, then what are we going to work on? We're going to hopefully hope it's benign, and that'll give her peace of mind. If the lump is cancerous, then, here's some more construction as to how this could evolve. So if it's slow going, it's not going to be as much of a problem, obviously, but if it's rapid growth and metastasis, we're looking at early death. Versus her refusing a mammogram, then we're going to constantly have this anxiety about the presence or absence of a lump, versus a lumping absence. Obviously, it's no problem. So this is just how you would look at constructing a decision tree and what it might look like in terms of how the patient might react, with varying factors involved. All right, guys, that's it for this week. I hope this was helpful. I'm looking forward to next week. We will definitely be getting into more of billing and coding next week, and the business of advanced practice. So make sure you do your readings. Next week, I'm going to also be including some extra articles. Billing and coding is a big deal in the APRN role. Everything you do needs to be billed and coded, and that is your responsibility in most of the places you practice in. So you're going to need to understand what billing and coding entails. So just make sure you read chapter 80, and I will get you some other articles that I think would help you understand the billing and coding mystery. All right, guys, have a great week, and I'll see you next week. Thank you.